Welcome, friends. This is Dr. Jaitly, your cardiologist from New York. Welcome to your favorite channel, MuniMeterHealth, on several social platforms. Obviously, we are dedicated to enhance medical education and patient education, as you see, to combine so that we can improve our clinical outcomes in our patients, chiefly from cardiovascular point of view first. So welcome again to be associated with MuniMeterHealth, your favorite video channel. I appreciate your questions, your suggestions, your like buttons, and of course your comments that you sometimes write, and I make it a point to write within 24 hours and reply that. So that's been my turnaround time. Without any further ado, I'd like to just mention that, again, we are doing short videos primarily to enhance, your medical education. It's not a substitute to your syllabus. Just make a note of it, please, medical students. It's a supplement to it. You can certainly use it in addition to your syllabi, which has been prescribed by universities and societies. So without any further ado, let's delve into the subject matter now. GLP-1. Now, these are some of the newer agents which have just emerged over the past, say, 4 or 5 years. And they've been now approved only recently in the past couple of years. And increasingly, we are understanding more indications, more advantages, cardiovascular advantages with these drugs. So they are, again, hypoglycemic agents. GLP-1 agonists, again, they are injectables. Remember, these are injectables now. They are not the oral agents, unlike the SGLT2 and then, of course, the DPP4, which we have discussed on a different video formats and different videos, if you will. So basically, GLP-1, what are they? So they are actually the incretin mimetics. In other words, they mimic the action of the incretin. Now, what is incretin? Incretin is produced by the enteroendocrine cells. Remember that. There are enteroendocrine cells within the guts. Now, these are all sitting in the guts. And as a result, some of these cells will produce the incretin in response to food. As soon as the food arrives in the stomach, you'll see the incretin production increases. And as soon as that happens, what's happening next? The insulin production increases. So the signal is straight to the insulin, which is the beta cells, and that's where the insulin production increases. But at the same time, what it does is it also suppresses the glucagon secretion, because we know glucagon will raise the sugar, so we don't want that to be high. Obviously, the sugars are already high right now within as they're getting absorbed from the stomach. The food is getting absorbed from the stomach. So the whole response, normal response, is the incretin will increase the insulin and decrease the glucagon production. So far, so good? Okay. Next, what happens is this also reduces the gastric emptying time. So there is a delayed gastric emptying time. So now you have more filled stomach, so the person is going to obviously eat less because your stomach tends to be full even after a shorter meal. So now your meal is going to be smaller, one, and two, the glucose absorption is delayed because now lesser food is now getting slowly into the intestines, and that's where the glucose absorption is occurring. So remember that. So the glucose absorption is also delayed. So it's a more sustained way of glucose absorption, if you will. So now what happens is we have certain agents which are just mimicking the incretin in general, and they're called GLP-1 agonists. By the way, we have 4 or 5 which have been approved now within the United States and Europe. The first one is exenatide. Now that's given daily or weekly. Again, these are all injectables. Remember that. They're not oral agents, so they're injectables. And then the liraglutide, which is a daily injection. And then you have albiglutide, which is also daily injection. And then you have a dulaglutide. So these are all tides, if you will. They all end in tides. So nomenclature has been fixed to this class of drugs, which is GLP-1 agonist. So dulaglutides, they're also weekly injections. So having understood that, GLP-1, remember the GLP-1, as I said, those are the receptors which are sitting on the beta cells. And the beta cells are where? They are the beta cells of Langerhans in the pancreas. So that's where they are in the islets of Langerhans. So the beta cells, that's where the GLP-1 receptors are, and they stimulate the insulin production right away. So you need to have beta cells in order to have GLP-1 receptors, and in order to have GLP-1 agonists to work on, you need definitely all of this to be in place. So that is very, very important. So it works, obviously, in that setting. The other thing that I would like to say is there's a little tilt here. I'm a little worried about this, but that's okay. The cardiovascular effects, as you see. The cardiovascular effects, as you see, the weight loss and a decrease in blood pressure. So these two are a norm, are given in all these four, if you will. So that's one of the things that's given here. But the fact is that lira has been associated with an FDA. Recently, the FDA indication says that the risk of MI, the CVA, and the cardiovascular deaths, etc., they're all reduced. By the way, they're all reduced. Sorry for a little tilt here, and we'll try to fix it at some other time. But liraglutide is the one which is now having that extra advantage cardiovascularly, just so that you know, outside of these four groups so far in the trials that have been completed. So that's the good news. The FDA has just, as a matter of fact, only in August of 2017, only a couple of months ago, was this an FDA indication that was added on, that in order, if diabetes patients, they have, say, coronary artery disease existing, then you can reduce the risk of MI, you can reduce the risk of CVA in those patients, you can reduce the risk of CVA deaths as well. So that's the interesting part, and here we are. So essentially, we are looking at GLP-1 agonists, injectables, which are of these 3 or 4 prototypes, and again, they work just like the incretin. Basically, they are the incretin mimetics, improving the insulin production, reducing the glucagon secretions, and the cardiovascular effects, as I said, they are beneficial, especially so with the lira. So there has been no adverse cardiovascular effects that have been at least known so far. So that's the good news. Okay, so hope all of this was helpful, and again, so next time when there's a question on that, and if you were to pick out of these 4, liraglutide is the one that you want to pick for your cardiovascular patient. Remember that a diabetic patient with a cardiovascular disease, a cardiovascular illness, should have a liraglutide on board if you were to choose any of these GLP-1 agonists. Okay, thank you again for watching MuniMeterHealth, and appreciate your input in advancing my global initiative on medical education, patient education. Thank you. This is Dr.